Lulu Wang's film, The Farewell, deals with the science of gerontology, which is a word I've never said before, but as time goes on, I think we're going to be saying that word a lot. A look at the ethics of medical decisions and practical questions of aging. Ahead on Science Goes to the Movies. Welcome to Science Goes to the Movies, a look at the stories of science and how they change our culture. I'm Lisa Beth Kovets. Today, we're going to look at Lulu Wang's film, The Farewell, with Dr. Elsie Jolade, clinical professor and coordinator at Hunter-Belleview School of Nursing. Welcome to the show.
Thank you, Elizabeth. Nice to be here.
In Lulu Wang's 2019 film, The Farewell, based on Wang's book, What You Don't Know, a family discovers their beloved matriarch has only a few months left to live, and they decide not to tell her. Much of the film takes place in China. Could anyone in America withhold that kind of information from somebody at a hospital?
No. It is unethical and unlawful to do that because your interaction as a caregiver with the patient and the family is based on trust. So you need to have that. The patient has to have an autonomy. That's one of the ethical principles that we operate with. That is, they have everything, all the information needed, and then they can make informed decisions based on the information provided to them by the caregivers. So in America, you can now do that.
So interesting that you say that it's unlawful, which we understand is just a cut and dried thing, but also unethical.
Everything that is done from the minute you go into a hospital setting, there is a informed consent that you are supposed to give. So it doesn't matter how sick the person is, you need to say, yes, I want you to treat me. Yes, I'm going to take this medication. So you need to have that informed consent. It's a law. That's something that must be done. So if you don't have adequate information, if completely the caregiver, the doctor, the nurses, or whoever is treating you do not give you the full picture of what is going on, how do we expect you to consent?
Got it. So in America, every decision is made based on patient consent, so they got to know.
Yes.
But so then what happens in a real New York City hospital if a family's sense of ethic and moral obligations in terms of care of their elderly relatives doesn't line up with the hospital's directives?
Yeah, I'm glad you asked that question because, as you know, New York City is a melting pot of every culture. Everybody from any corner of the world is in New York City. Yes, we do come across those situations. So the family member can approach us and say, oh, we do not want grandma to know she's dying, or we do not want you to tell her this is what is wrong. The first thing we do is we let the family member know that ethically and lawfully we need to do this. So we have to explain that to them, that if the family member, grandma does not want to know the details, it's a different story. So we're going to have an environment where the caregiver, the family member, and grandma are both in the same room. I'm going to say, okay, grandma, this is what your son said. Do you want to know the details of what we're going to do for you, or do you want him to make all the decisions?
Wow.
So based on what the grandma or grandpa says is going to determine, but we are going to let the family member know that in this country and what we do here, ethically and lawfully, it will be against our principles to not disclose.
You know, in the movie, all of these ethical decisions fell on the family, but in real life, do these ethical decisions often fall on the nursing staff?
Not all the time, but I would say most of the time, the nurses have to identify these ethical situations and reach out and advocate as needed, or reach out for more support and resources as needed. For the caregivers in the hospital, nurses are the ones that spend the most time with the patient. So we as nurses get to see a lot more. So we tend to be the one to recognize these advocating having to take place, or a potential ethical violation, or we could call it ethical dilemma. nursing school prepares their nurses to be ethical. We take classes, there's so many scenarios of what is done in the preparation of nurses. But other than that, experience and everything else also comes in. So if nurse A she feels she cannot handle the case, then she will escalate as needed.
You wrote your doctoral thesis on how to
assessing the ethical competency of a new graduate nurse. That was my dissertation for my doctoral degree.
What a great movie.
I know. I don't know how that felt in. You called me up and I'm like, okay, this is something I'm familiar with at some point.
So how do you assess the ethical capacity of a newly graduated nurse?
So my whole 60-something page dissertation, I don't know how I'm going to abbreviate that and bring that to the set and just give you like 2 sentences. That would like take a little bit longer. But some of it is, are the nurses prepared? Now, I don't know if you're aware that now we want all our nurses to be baccalaureate degree prepared, because in the past we have different entry level to practice, like associate degree or something less than that. So now most nurses are now baccalaureate degree prepared. And the reason being that, other than being a nurse and being able to take care of the patient, we want them to have other trainings and other education that they can bring into the table. Ethics is one of that. Not just knowing the few definitions in ethics, is actually having a full course or 2 in biomedical ethics that will prepare them for this. So we do that. So when we say new graduate nurses, it's not that nurse that is just out of school last year or 3 months ago. Definition of a new nurse for my dissertation was 3 years or below of clinical practice. So they are still considered new because they are very new. They are novices. They are just trying to get things done. Their ability to critically think and apply all they learn in nursing school to the situation is still very limited. So when they are faced with ethical dilemmas, how do they handle it? So that was what I worked on for a long time.
Just the plain concept that this is now part of nursing education,
Right.
and nursing practice.
Yes.
Is not just care for the body.
No.
But you have to know how to make the hard choices.
Right. So the first step is the nurses have to be able to identify an ethical dilemma where there is one. Because if you don't know, you just go ahead and do whatever you think you're doing. So that is the first step, is how do nurses recognize ethical dilemmas when they occur? Okay. So if the nurse is able to identify that, now the next step is, then what do you do when that dilemma occurs?
You know, I'm sorry to go off script but if I may, Evan Handler from Sex and the City, the actor from Sex and the City, suffered from leukemia, said something in his show that when he was 20 years ago on the floor, the fact of his dying would be the least interesting thing that would have happened to the nursing staff that day. That he felt that many years ago, that the nursing staff were 20-year veterans who every day came into combat, and their experience of the most significant thing that ever had happened to him in his life was just another day, and that was just a mismatch back in the day.
So what I would say to that is thank God for where we are now in nursing education in academia. And this is why I'm so proud to be where I am today at Hunter College School of Nursing, because one of the reasons why there's a lot of study that has been done that when nurses are educated and they are prepared at the baccalaureate level, they bring in more to caring for the patient and the outcomes are the best. So 20 years ago, that was not the case. 20 years ago, we have diploma nurses. We have associate degree nurses. And those trainees are just focused on knowing the body part and what to do when the person is sick. That was the major thing that was taught in the nursing school at that time. But thank God that things have changed and we have come a long way. I would tell you that in the last 10 years, and even a little bit more than that, all those have changed. The curriculum have been revised, and what we do and how we prepare our students to become nurses have really, really undergo a lot of transformation. It's unfortunate that he had that experience. I bet today, if he goes in for any type of treatment or he knows anybody, the experience is way different. It's much better.
Spoiler alert, if you haven't seen the movie, go see the movie. But if you don't want to know, I'm about to reveal the ending. In real life and in the fictionalized version, Lulu Wang's beloved grandmother does not die. And throughout the movie, Nene, played by Zhujin Zhao, is surrounded by family and friends, which is not a cure for cancer, but how important are those family and friends to our longevity?
It's very important. Loneliness can lead to decreasing their frailty and disease not getting better. Having family around, having friends to count on, especially family, children, grandchildren, nieces, nephews, and all of that, it's very important to the overall health of the elderly. There's a lot of research that has been done to prove that, and even now in the hospital settings, care is now holistic. It's not just giving medications for what is wrong with you. We encourage, bring pictures. If you have a pet, bring your pet. If you have a grandchild that can visit, we even have open visiting hours to accommodate that, because we know that that helps people to get better and to live longer and to respond well to treatment.
In The Farewell, Nene, without question, is going to grow old in her own home. In America, the newfangled yet antique concept of aging in place is becoming more accepted. What's happening to make that idea more appealing?
Well, for a long time in America, people get old, we ship them off to a nursing home, which tends to be impersonal. It's not a familiar environment, children are not there. When people grow, aging in place is really catching up, because you allow that elderly person to be in familiar surroundings where they have all their mementos and their memories and everything there. As long as they can afford it, it is very good, because it actually helps their mental capacity and ability for them to even live longer. People are in nursing homes that they don't have anybody visiting them for the whole months and months, except maybe on Mother's Day, on Father's Day, somebody shows up with flowers and that's the end of it. Yeah. They get care in nursing home. I'm not saying it's not a good idea to be in a nursing home, but being in your own home is very wonderful. And now caregiving can be done at home for patients. We now have doctors and nurse practitioners that go on home visits, that came back already, that go to visit people in their own homes to maintain care and to be sure that they are doing well. We have caregivers that will go to people's homes to go help them, either with dressing up, making food, or all of the above, or medications and everything. So now there's so many available ways to stay at home and to actually be cared for and grow old at home. And a lot of people are choosing to actually die at home. So which is, I think, is a good thing.
HBO's mega hit Game of Thrones created huge opportunities for aging, bearded European actors to die violent cinematic deaths. And we like our fictional depictions of elderly characters to be cocky and confident and heroic. But are these fictional 90-year-old men still swinging their literal and metaphorical broadswords good models for the elderly? Or like the too thin and too perfect young female bodies we see on screens, are these nearly impossible elderly body images good, or are they burdensome?
I think they are burdensome because, yes, people are living longer, which is wonderful, but the longer you live, your body changes. So a lot of our elderlies have what we call comorbidities. There are things wrong with them, which are normal physiologic changes in some instances. And over the years, it's like as we get older, a lot of things happen to the cells, to the body, to the organs and stuff like that. So what the cinema, the movies are doing, as much as it's wonderful for movies, in real life, only a very tiny percentage. I would say, I don't have the exact numbers in the top of my head, I would say less than 1% of our adults will be doing that.
So you started out working with babies.
Oh, yes.
How did you end up with the elderly?
So my career in nursing started in Africa. I was born and raised there. My initial nursing education was in Nigeria, that is in West Africa. So I was a nurse midwife. There weren't that many doctors around, so I was a midwife for the first 10 years. And I delivered like up to 500 babies or even more than that in my lifetime. Then the opportunity to come to America came up, and I came to this country. I wanted to continue delivering babies and everything, but then I realized that in America, you don't actually deliver the babies, the doctors do. So the nurses are there doing other things. And I'm like, I'm not going to do that. I'm so used to like catching the baby. Why will I just stand by and watch somebody else do it?
You're the star.
I'm like, no, I don't want to do that. So I decided to do something else entirely different. I ended up with adult care, and I was a med-surg nurse. Then I became an ICU nurse. Then I went to open heart ICU. And as time goes on, one thing led to the other. And with more education and everything else, I find out that I love geriatrics. I love geriatrics because caring for them during my time at New York Presbyterian as a CTICU nurse and as a clinical nurse specialist for the cardiac service line, that time spanned over 23, 24 years. I was able to come in contact with a lot of geriatric patients. Not all my patients were geriatric, but most of them were, and I was able to see everything that we're speaking about. I was already working when I was doing my doctoral studies. So my dissertation of assessing the ethical competency of the new graduate nurse came from my experiences when I was working as a CTICU nurse at New York Presbyterian. So it's an evolving thing. It's like what happens, and now I find myself gravitating to gerontology, and I love it. I love it.
So what's the difference between geriatrics and gerontology?
Gerontology is the study of older people. Geriatrics are just a term for older people. It's about the same thing.
And for a young nurse starting out, is gerontology a good career?
It is a good career. The good thing with nursing education these days is that there's so many options of what you can do. I graduated nursing school in 1981. That was a little bit ago. When I was out of nursing school, as a nurse, there's a few things you can do. You don't have a lot of variations of what you can do. But as time goes on, as nursing education gets more and more revised and updated and everything, now you can do a lot of things. Geriatric nursing, to me, is the way to go because we are living longer. And people are going to be a more geriatric population in our societies, are getting more. People are at home, and if a typical person is that you have somebody in your family, if not your immediate parents, uncle, auntie, somebody on your block, somebody you know that is elderly. So this is a phase in life that we're going to see for a long time. So I think that being a gerontology nurse is a wonderful thing to be.
And what about technology? Is this great boon in technology a burden for the nursing staff or a boon?
It's a boon. I love technology. We can do a lot more with technology. We can get things done faster. Technology is in everything we do these days, from caring for your patient, looking up your test result, checking if medications can interact. There's so many things you can do that are faster and better with technology. I believe technology is a boon. It's very good for us.
And how is Hunter-Belleview preparing nurses to work with the future geriatric populations?
I am so fortunate to be at Hunter College. The School of Nursing is one of the premier training centers for nurses in this city. Hunter College and the School of Nursing have a national reputation as one of the best institutions that prepare nurses for practice, either on the undergraduate level and at the graduate level. Like I was alluding to it earlier on, we are always revising our curriculum. We have a lot of scientists on our faculty. We have a lot of clinicians on our faculty, we are always looking for the best evidence and the best ways to prepare the best nurses possible to care for our diverse population, both in New York City and across the country. So we are always updating that, and we are always making sure that what we are training them is translatable to care. So we don't want to just train them to know things in their head and not be able to do it. And I'm proud to tell you that our graduates are always preferred in so many institutions in the city. They would rather like hire a Hunter-Belleview graduate as a nurse at NYP, at Columbia, at NYU, and all these other fancy places in the city, because we are always, our faculty, our dean, we have a group of academic professionals that are always updating and making sure that we give the best and the most current way to educate our nurses.
And the students do not graduate with gigantic debt burdens.
That's right. That's the best part of it. So it's very affordable. So that's why our population are very diverse. You see a lot of students there. Every demographic is represented in our students. So you don't have to come from a rich background. A lot of them are first-time college graduates. A handful, like a good percentage of our graduates are first time, and thank God for that financial burden that is alleviated by going to Hunter-Belleview.
We're all going to face elder care, either for ourselves, for our loved ones. What are your recommendations to all of us when we get to this? How do we prepare ourselves? How do we act?
I think that the planning has to start very early. Like I said earlier, we are all getting older, living longer. You can see somebody that has their elderly parents that they're caring for, and they have their own children they're caring for, and this person is already in their 60s. They're not like very young anymore. So the experiences from that, what goes into what does this elderly parent have or does not have. And if you don't have that, that is okay. But you want to know that chances of you living longer to a really good old age is very high. You need to have advanced directives. That is, have something written that when I get old and when I get sick, if I am unable to make decisions for myself, I want have somebody, a child, spouse, niece, nephew, friend, significant other, have that and have a discussion with that person.
So don't leave it to chance.
Don't leave it to chance. So don't say, oh, she'll know what to do. No, have a conversation. If I get sick and if I cannot make decisions anymore, I would like for you to do everything. Everything meaning whatever the doctor tell you or the new treatment that may make me get better, I want everything done. Have that conversation. Or if you want to have just a little bit done, some people will say, I don't want to have a breathing tube. I don't want to have artificial feeding. I want them to treat me, and if my heart stops, please don't start jumping on my chest and trying to revive me. Let me go. So have that conversation.
If you want that.
If you want that, or if you don't want that, and make sure that the person that you are selecting as your next of kin, POA, that is power of attorney, is comfortable with your wishes.
Getting back to those questions of ethical decisions that need to be made.
Right. So that person has to be comfortable. So if I say, I don't want to be resuscitated, that is, if my heart stops, let me die. And if the person that I want to be my POA doesn't feel comfortable, if the doctor say, well, we can still revive her, if that person preferred to let them keep going, there's something not matching.
Right.
So that's why you need to have that conversation. That's number one. Financially, we need to have something, hopefully. We are in a great country where there is a lot of things available to our elderly, but not everything that is needed is available. So what are you doing about that? Do you have some retirement account? Do you have things that you want to put aside for your
Right.
old age, because you're going to get old and you're going to need somebody to care for you.
But growing old is something I think that we didn't want to think about because it seems so horrible. It doesn't seem so horrible anymore. I mean, we're not going to Game of Thrones, B90s and swinging our broadswords.
Yes.
But still, there is some glory and thrill in aging that I think that certainly in the movies we don't address.
Right. So the thing is that New York City is a wonderful place in the sense that we have a lot of cultures and demographics that meet here. And since I practiced most of my nursing career in New York City, I keep referring back to New York City. Some cultures don't want to talk about age. They minimize their age, and some cultures, they glorify that they are older and wiser and they are respected. As in the movie, The Farewell. So Nana is older, everybody look up to her, and she has the wisdom, and she's good. She's happy with herself being older. I'm from Africa. I'm from a tribe that the older you are, the more respected you are in the community. So I have no problem telling people how old I am. And I look forward to getting old. But then you have, on the flip side, you have people that don't want to get old. They're always injecting something to make them look not wrinkled and look perfect and keep looking like 25-year-old all their life. There's nothing wrong with that. Whichever spectrum you belong to, you just do what is good for you. That's what I say.
Dr. Jolade, this has been such a pleasure, but unfortunately, that is all we have time for.
Thank you so much. It's been a pleasure being here.